So these are the women's health issues from 20 to 40 years of age. Okay, so we're going to talk about briefly about each of them. So somebody asked about infections, so here it is. So sexually transmitted infections. So as the name suggests, they are sexually transmitted. Okay, so you are at an age where you are either already become sexually active or you're planning to become sexually active in near future. What one needs to be very, very aware is that sexually transmitted infections are very, very common. Now, I live in the UK, so here there is a very nice sort of a trend or a way people do things. So when two people come together and they decide to be sexually active, they both go to the sexual health clinic and they both get tested for various sexually transmitted infection, even if they never had one. Okay. The reason one needs to be very aware is because the basic difference is because of the anatomy. Okay. A male's genitalia are on the outside. So if a guy develops a rash or an ulcer on the penis or a discharge, it will be immediately visible, and the guy will be able to seek treatment and get treated sooner. A woman's sex organs, they're internal. So it will become very, very difficult for her to become symptomatic. And that's why in women, majority of the sexually transmitted infections are sometimes asymptomatic. That means you never get any symptoms. Now, for example, there is an infection called chlamydia. Now, if one person gets chlamydia, the body will fight it. Body will clear the infection. So they might not need treatment all the time. But this bacteria goes from the vagina through the uterus into the tubes and damages the tubes. Okay, and that will block the tubes sometimes, and then they will have struggle to get pregnant. And that's the reason that uh, everybody should be very, very aware of sexually transmitted infections. And until you are in a committed relationship, you should practice safe sex. Okay. So as long as you are consenting for it, you are not forced into it, that's absolutely fine. But if you feel like you're being coerced into it or you're being forced into it, please seek help. Okay. And the pills, they will work as a contraception. So pills will stop you from getting pregnant, but they will not protect you from infections. So the only thing that will protect you from infection is a barrier contraceptive. So either a male condom or a female condom. So until you are in a committed relationship, please, please, please practice safe sex. Okay. Menstrual irregularities. So again, as we talked about while answering the questions, that a regular cycle is maximum 1 to 2 days variation, 3 to 7 days of bleeding, not too heavy a loss, and not too much painful. Okay. PMOS, again, we just talked about it. So it's a very common condition in India, and the only way to treat it is with hormones. So you need to, majority of 70% of PMOS patients are overweight. So they need to work on reducing their weight. That does help. High protein, low carb diet helps. Exercise helps. But they need some kind of endometrial protection, which can only be offered with hormones. And whenever they try to get pregnant, they should be trying maximum of 6 months. And if they are not pregnant, they should see the gynecologist. Endometriosis is a condition where a tissue like lining of the uterus grows outside the uterus. So most commonly it grows at the back of the uterus, sometimes on the ovaries, sometimes a cyst develops into the ovary, and in severe cases, it can affect bladder as well as bowel. And that's why I said that if periods are very, very painful, sometimes that could be an indication of endometriosis, and that's why they need to be investigated. Fibroids, it's a growth of muscle of the uterus. The muscle divides hundreds and thousands of times and turn into a ball-like structure. And they develop in the wall of the uterus, and they can cause issues either because of their size or because of their location. So if size is small, but if they are affecting the cavity of the uterus, the woman may struggle to get pregnant. If they're on the outside and really big, they can press on your bowel or bladder and they can cause pressure symptoms. And again, heavy periods could be an indication of fibroids. So, two heavy periods, they need to be investigated. Ovarian cyst, yes, somebody asked that question. So, cyst means a fluid filled space. Okay, so sometimes a follicle in the ovary does not ovulate and gets filled with the fluid. And there are different types of these cysts. One is a simple cyst. That means it's small and it only contains protein-rich fluid. And majority of the times, body will take care of it. Okay, so if it is less than 3 centimeter, we don't worry too much about simple cyst because they tend to resolve on their own. But any cyst, if it grows more than 5 centimeter or more, then there is a risk of torsion. That means the ovary gets twisted on its pedicle, and that can stop the ovarian blood supply. And sometimes, because of that, the ovary dies if not operated within a stipulated time frame, and the woman may lose the whole ovary and the tube altogether. There is endometriotic cyst, which is filled with old blood. Sometimes there is a hemorrhagic cyst. That means it's a simple cyst, but the woman bleeds into it. Again, it tends to get resolved on its own. Then there is another type. It is called a dermoid cyst, where you get all those hairs and teeth and bone into that cyst. And borderline tumors, that means they are not exactly cancer, but if untreated, they have a tendency to turn into a cancer and obviously a cancerous cyst. Okay. Uterine anomalies. So when you were a baby in your mother's tummy, the uterus is developing, and the uterus develops by joining two tubes. And when there is a problem, then the uterus might be sort of a ill-formed. That means the tubes are there, but they didn't join, or only one tube developed, the other didn't, and those sort of things. Subfertility means people struggling to get pregnant. So as long as a woman has regular cycle, guy has a normal sperm, and they don't have any issues with intercourse, usually by the 3 years of trying, 93% people will get pregnant, and only 7% will need some help. Okay, but if there is any issue, it is always better to seek help. Cervical cancer, it's the commonest cancer in India amongst women. And one of the major reason is a viral infection. It's called HPV, human papilloma virus. And this virus is sexually transmitted. And that's why the age at first intercourse is very important. That means if a girl is sexually active at a very young age, she can get infected and the virus remains in the neck of the uterus. And eventually in next 20, 30, 40 years, it can lead to cancerous changes. And that's why there is a vaccine available now. So it's called Gardasil vaccine that protects against 6 major variants of HPV. So if you haven't had it yet, please, please, please contact your gynecologist and get it done. It is so effective that now in Europe, the only people with cervical cancer we are getting are the ones who haven't had vaccine. So it's really a lifesaver. You need 2 doses, 2 doses, 1 month apart, and up to 25 you can take it. After 25 you have to do a test called cervical smear test, which is done every 3 years. So if you are 25 or over and haven't had a vaccine yet, you can still take the vaccine, but you will be better off having cervical screening every 3 years as well. And please do tell your friends, your family members, if they haven't done so yet. Okay, it's very difficult to sort of convince them, but tell them that this is a lifesaver. Okay, and it's only once every 3 years, so it's not like you have to do it every month or every 6 months. Uterine cancer is the cancer of the uterus, which mainly happens in older women, very rarely in younger women. Ovarian cancers, again, the symptoms are very, very vague. And that's why that's the trickiest part in diagnosing them. By the time we diagnose ovarian cancer, it's already too late. They are usually stage 3. And that's why any abnormal symptoms, it's always better to get investigated. And as a woman in India, you have the facility that you can get your own investigations done. So I strongly recommend that uh, at your age, it is worth having your full health checkup at least annually to make sure that there are no issues. And then obviously there are disorders of hormones like thyroid and pituitary and hypothyroidism. Okay, let's go on the next topic. Okay. So that is the reason we designed this app, Nari, Naree. And as I said, that it is very, very important for you to track your cycles properly. So when you download the app, you register your medical history and everything. You got evidence-based blogs. I make patient education videos. So you can find me on YouTube as well and subscribe to my channel. So there are different videos about women's health and everything. You can store all your medical records in one place, so you won't lose them ever. In the menstrual calendar, you can choose a date and then put all the symptoms. There is a pain score as well. You can write down how painful it is. It asks you about your mood, amount of bleeding you're having, different symptoms. There is a free text available as well. So you can use it as a journal or a diary, and the AI integrated in it will pick up any issues with your menstrual cycle. So it will sort of flag up that there is some issue with the cycle and you need to show someone. So please, please, please download the app, start using it, share with your friends and family, ask them to download it as well, because it's very, very useful for everyone, including men as well, because the menstrual diary for boys will appear as a mental health diary. And now talk about mental health. Okay, it's very, very important in this day and age. Okay, so your mind matters. Okay, it is as important as your body. We all have feelings, and that's absolutely fine. Okay, so you might have six packs, but if you're not feeling well, it's of no use. And that's why I would rather say mind is far more important than your body. Okay, and we all have feelings, and that's absolutely fine. Okay, there is nothing wrong with it. So, what is mental health? It is about how we feel, how we think, and most importantly, how we handle the stress. Okay. So, as we talk, that we all feel happy, sad, angry, worried, and they're all normal. Like, even if you take your days, today, like this morning, you probably missed the alarm, woke up late, so you were a bit anxious that you're going to be late for the classes. But then, as soon as you came on the road or you got your bike started and you were on, still managed to reach on time, now you're happy. Then you saw your friend, you're happier. Then the teacher came in, it was your favorite teacher, you were happy. Then the next class was a teacher you probably didn't like, so you were not very happy. Then you had a fight with your friend, now you're sad. Then somebody said something, you got angry. Now you're going back, worrying about what happened and everything. So, see, we all go through a whole roller coaster of feelings on a daily basis. Yeah. And that's absolutely fine. That shows that we are alive. That's how we feel. Okay. But obviously, growing up, it's sort of a tricky time for you guys. Like, until you came to the college, most likely your parents or teachers were making all the decisions. Now, because of periods and everything, your body is changing, your hormones are changing, your moods are changing. Some of you have become more sensitive. You might get easily upset. You might be confused as well, because Until now, people were taking decisions. Now you are developing your own view of the world. Yeah. See, I don't know what you guys talk about, but some of you might actually supporting Israel is right. Some of you might feel actually what Palestine is doing is right, or Israel is wrong, or US is wrong, or Pakistan is wrong, or we are right. And see, you might have certain religious beliefs you grew up with, and you might not agree with certain things from different religions or your own religion and everything. So your worldview is changing. You might be getting different information. You go on one channel, they are saying something. You go to another channel, they are saying something. Reels are telling you something different. Somebody is creating fake AI videos that is confusing you. So this is all very confusing even for older adults. Okay, so this is very, very common. What is important is how you handle these things. Okay, especially at your age, studies are more important. You got exams, you have to do well, and there is homework, there is a peer pressure. She Your friend got so many marks, or your friend got so many likes on a reel, and you are not getting that much. There is a fear that you may disappoint your parents or teachers, and there is nothing to be ashamed about it or worry about you feeling that way. Okay, you're not weak because you feel that way. We all have been through that. Okay, so what is stress? That when your mind feels overloaded. Okay, so too much homework, that you might say चार assignment दिए हैं दो 2000 word के, now how am I going to finish this and everything. Or exams are coming up, you may or may not have performed well in your previous exam, and now you have to make up in this exam. Or it could be neat and the paper is leaked and now the exam is cancelled. I don't know what's going on, but obviously, or you might have an argument with your friends. Obviously there is a social media pressure. So we all having different stresses. Okay, and that's absolutely fine. Small stress is actually productive, because if you're not stressed about exam, you're not going to study properly. Yeah, problem starts when there is a too much stress. Okay, so if a small stress, you're studying properly, you will perform well in the exam. But if you're so stressed that now you're panicking, you're crying and not concentrating, then obviously you can see that that is not going to help. So it is that type of stress which is actually counterproductive, where you will need help. Okay, the signs, these are some of the signs which mean that you need help, is that you're feeling sad quite often. Okay, let's say, for example, you were late, or you had a fight with your mother or father or your sibling, or you had a fight with your friend. You were a bit sad for a couple of hours. That's expected. But imagine it's been 3 days and you're sad about the same. Probably that's not very healthy. Yeah, or you are unable to sleep properly, or you got no interest, like your friends are playing or watching a movie and you're just sitting in a corner sulking or doing something, or you're crying too often, or you're feeling lonely even with your friends or family. Then one needs help. Okay, and because of that, you need to talk. Okay, talking helps because the feelings become lighter. Like last week I operated, I had a difficult patient, and that's why I had to call my senior colleague afterwards. So when I talked to her, she told me that, okay, these things happen, this was not complex, in like it wasn't too complex, you handled it well. And that made me feel better, that I wasn't sad, that okay, yes, it was a complex case and what I did was right and everything is fine. So your problem feels smaller. Most importantly, you don't feel alone. And that's why you need to talk to your parents, you need to talk to your teachers. If your school or college has a counselor, please do speak with them. Okay. Your friends really matter. Good friends always listen. They support each other. They say kind words to each other. And that's why if a friend is sad, you be that good friend. You listen to them, you remain kind. And if you're worried about something, you speak to an adult, trusted adult. Okay. Social media and mind, there are plenty of studies which show that how social media affects your mind. Okay. And now we are all almost spending like 6 to 7 hours on a screen. Like I'm teaching you on a screen, then I got few calls, then I'm going to sort my emails. So we half the time, like even in the hospital, I'm using computer to write down my notes, looking at the blood results, images, and everything. So we are all surrounded by it, but obviously the social media is even worse because there is no way to find out right from wrong. Okay, there is now AI. People can put Amitabh Bachchan's picture and say he said this or she said this and everything. You got no way to find out what is exactly going on. But what you need to appreciate is that online life is not real life. Okay, the photos, videos are edited. The likes don't measure your worth. Okay, just because one of your friend got 300 likes and you only got three doesn't mean that you're less of a person than her. The most important thing is limit your screen time. Okay, so before you go to bed, you make sure that at least an hour you won't look at any screen. Talk to your family, read a book or something, but do that and always try and follow positive content. Okay, these are some of my favorite photographs which show that what you always see is not always true. Okay, so it's very difficult, and that is the challenge we are all facing at the moment. Okay, how do you care of your mental health? You need to sleep well. At your age, you need at least 8 hours of sleep. So make sure that there is no screen at least an hour before you read something, you take proper sleep, you eat healthy, exercise, play. Exercise produces endorphins that lifts up your mood. So whatever you feel like, it doesn't have to lift weights or anything. It can be any brisk walk, run, jog, badminton, football, whatever you feel like. Talk about your feelings, don't bottle them up. Okay, so find a trusted friend or maintain your journal. As I said, in the Nari app on the menstrual calendar, you got a free text, so use that to keep a journal. Take break from screens. And my favorite is reflection and self-correction. This is one thing which is always going to help you to succeed, no matter which field you choose. Okay, so you need to reflect on your behavior, and there has to be always self correction. And I'll give an example. Let's say you had an argument or a fight with your friend. Okay, it went on for half an hour. Each of you said some unkind things to each other, and it got sort of riled up and everything. And now you're at home. Okay, take your journal and start writing down how you're feeling, how it happened. And then you will realize that actually this was the reason it started. Yeah. Then you will realize actually I said these things, probably that was not very kind and possibly uncalled for. Okay. And probably that escalated the situation. So, what will be your reflection? That, okay, this happened. Because of that, the fight started. Yeah. So what the reflection is, next time when such thing happens, how am I going to avoid that conflict? Okay. You cannot control how other people will behave ever. The only thing you can control is how you are going to behave in that situation. Okay. So your reflection will be, next time these things happen, this is what I'm going to do. I will either move away from that situation, or your self correction is, I said those things. Probably I shouldn't have said those things. Or I said those things in a way, next time I will change the way I'm telling my friends. Okay. I use the same thing. I will use your feedback like, oh, Himanshu, you did this well. I didn't understand this. Or some people would have said, okay, this thing, this thing. So that's how I modify my presentations, my examples, and everything. So that's your reflection and self correction. You are at an age where you're going to get into good habits, and those habits are you're going to carry for life, and they are going to shape how your career will progress. So if you focus on the reflection and self-correction, I promise you, whatever field you choose, you will succeed. Okay. So now This is the breathing exercise. We do it every time we do this course. So all of you can sit upright, please. If you want to stretch, stretch a little bit. So what you will need to do is sit upright, close your eyes, and then breathe in and count 1, 2, 3, 4. And now hold your breath for 2 seconds. 1 and 2. And now breathe out and count 1, 2, 3, 4, 5, 6. Okay. And now we are going to do it 2 more times. Okay. Breathe in. 1, 2, 3, 4. Now hold it for 2 seconds. 1, 2. And now breathe out. 1, 2, 3, 4, 5, 6. Breathe in. 1, 2, 3, 4. Hold for 2 seconds. 1, 2. And now breathe out. 1, 2, 3, 4, 5, 6. Okay. Do you feel slightly better? I definitely. Okay. So we need to do this every few hours or whenever you feel overwhelmed, just get to a safe place. You can do it standing, sitting, whatever, and you will feel the difference. Definitely. Okay. So it sort of helps you to calm down. Okay. When you seek help, if the sadness is lasting for weeks, okay, a couple of days is fine, but if it's lasting longer, or if you feel unsafe, okay, we are really living in a really crappy world at the moment. So I don't know what your situation is like, but coming to work, coming to college, going to college, if you're feeling unsafe, please, nobody should feel like that, and you need to raise an alarm. If you are feeling scared, worse, you feel like hurting yourself, okay, every week at least 100, 200 people commit suicide in India, which is very awful thing. And most likely because they haven't got the help they need. Okay. Help is always available. So please speak to someone you trust. What is important? You are important. You matter. You are unique. Out of 7 billion people, you are a unique specimen. Nobody is like you. Okay. You are very valuable. Your feelings do matter. And asking for help is very, very brave. Okay. That's the bravest thing one can do is ask for help. Okay. That's not a sign of weakness. That is actually a sign of bravery. And we all need it. Like I've been a consultant, I've been a doctor for almost 21 years. 31 years. I've been a consultant for 12 years and I still need help. Okay. So there is no shame in it, asking for help. It's a sign of bravery. Okay. So take care of your body as well as your mind. And if you ever feel low, talk, share, and ask for help. Okay. Thank you.